It's time to head back to school, which coincidentally is the perfect time to schedule an annual wellness visit for your children to make sure they are up to date on immunizations, screenings, and any tests they should have. It's also a good chance to check their developmental progress. Joining us now to explain is Dr. Jeremy Wigginton with Blue Cross Blue Shield of Louisiana. Welcome back.
Thanks, I appreciate it. Thank you.
Of course. So what should be in the forefront of parents' minds as we head back to school?
Sure, yeah, well, we're still in the summertime, but it is back to school time, so that is a really great time to think about wellness for our children. So your kids really should be thinking about, for your children, their wellness as well. And so this is a really good time to think it's a new year, so what do we need to do for our kids? And so some main things are that getting that wellness visit in with their regular physician, pediatrician, or family medicine physician, so that they can be checked to make sure they're up to date on vaccines, check their weight, check for certain signs of development, make sure their language and physical development are coming along. And so that's really important to get checked out every year, every single year. And most health plans actually cover wellness visits at no cost or very low cost. And so you should definitely check the back of your insurance card for the customer service number and go ahead and call that number and see, what the out-of-pocket cost would be for those wellness exams.
Wonderful. And then tell us, why are vaccinations so important?
So part of that wellness exam, a big component is vaccines. And when we were kids, we probably all remember getting our shots, our vaccines. Those change quite a bit because we learn of new diseases, new things that children should be vaccinated against. So we want to always be up to date on those. And these shots or vaccines are a way to prevent a lot of not only childhood illnesses, but illnesses that could progress into our adulthood. And so getting up to date on those and checking with your physician every year to make sure your child is up to date on what they need and it is age appropriate. And another thing to think about is there's usually two reasons why parents kind of have trouble with vaccines. Either they have concerns about the vaccine, or they may think they don't have access to the vaccines. And so if you're concerned whether you have access to a clinic or a provider that may have the vaccines that your child needs, also you could call the customer service number on the back of your insurance card. They should be able to answer those questions about where can you take your child to get the vaccines, and then again, how much would you have to pay for that wellness visit to get them up to date. The second piece of that is, why are parents concerned about vaccines? And usually they have a lot of questions. And so talking to your child's doctor every year about any concerns you may have over the individual vaccines is a really good idea, and they should be able to answer all of those questions. Most people don't realize that vaccines are just a way to prevent illness. And a lot of people say, well, I don't want the vaccine because it makes me sick, or my child gets the illness afterwards. But the thing to remember is that vaccines are just a way to stimulate our immune system against those illnesses. And so when our immune system gets stimulated, children may get a fever, they may get soreness in the site where they get the vaccine, or a little redness. There are things you can do to prevent that. So always talk to your doctor about that.
And when we take a look back, just at the measles outbreak across the country, a pivotal moment for all of us. What do we learn from this, or what can we learn from
Exactly. We have not seen an outbreak of measles like this in over 20 years. So right now in about 28 states, there are over 1,000 cases of measles. And this sort of went away for a while because vaccines, and we were able to prevent the spread of measles. But now, due to some of those problems, either access or concerns over vaccines, children are now not getting vaccinated, and so these cases are popping up. Luckily, the last time I checked the data, we have not seen a confirmed case of measles in Louisiana yet, but thinking about those vaccines are really important so we can prevent it from coming to Louisiana and prevent it from spreading anywhere else in the United States.
Definitely. Let's talk briefly about childhood obesity.
That's a really good question. So most people think of obesity as being an adulthood problem, being overweight, but especially in the South where food is such a big part of our culture in Louisiana, kids are very susceptible to being overweight as well. And so that annual wellness visit is a time to get your child's weight checked and make sure it's appropriate for their height and age, and that's called a body mass index. And so that can be measured and calculated for your child to make sure they're at the right weight, and you can talk about diet and exercise that's appropriate for your child. And obesity in childhood tends to lead to obesity in adulthood and can then become issues like diabetes, high cholesterol, high blood pressure. We're starting to see more and more high cholesterol and high blood pressure in children, can cause joint problems, increasing your chance for certain types of cancers. So we want to do everything we can to keep our children away from obesity now and later. So it's really important to do that as well. And also some insurance plans also cover some types of counseling and dietary services as well. So again, calling that customer service number on the back of your card, you can usually get those answers.
All right, wonderful. Thank you, doctor.
Appreciate it.
To learn more, you can head to bcbsla.com.